Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Maria Iliakova. She is a bariatric and general surgeon. Her Kevin MD article is titled The Joy of Surgery, How One Doctor Discovered Her Passion. Maria, welcome to the show.
Thank you so much, Dr. Foe. It's so nice to be with you.
We'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Yeah, so I am, as you said, a general bariatric surgeon. I'm actually just finishing up my first year of practice, which has been a wild ride and a great journey so far. I'm originally from Kansas City, now in Iowa City. So I seem to like places that have the name city in
Mhm.
them. But first and foremost, I'm actually an immigrant. My mom and I moved to the United States when I was 6 from Russia. So this country has definitely afforded us some opportunities that are pretty unique. Coming just with a couple of suitcases to becoming a bariatric surgeon, it takes a village, but it also takes a place like the United States to make that happen.
So we're going to talk a little bit more about your surgical journey and training in a little bit. But you mentioned that you just finished your first year out of fellowship or residency. So how did that transition go from training to attending?
Oh my goodness, it's almost like I didn't do residency or fellowship sometimes because the learning curve, and I've heard this before. I remember my attendings telling me this in residency and telling me in fellowship, your first year out is going to make you feel like you don't know anything. And I would say that's true. There's so much more to the practice of medicine and surgery than just what you learn technically. Technical skills are the baseline, right? You
Right.
have to know what you're doing. You have to be able to be safe and be competent and all those things. But actually getting your patient to the OR safely means you have to manage a clinical team, means you have to manage a surgical team, means you have to get your administrators on board with the tools and things you want to use, means you may have to do some marketing to get patients in the door, and certainly develop those kinds of relationships with patients. So it's a huge learning curve, but one that I have really enjoyed, and have really taken away a lot of valuable things from.
So those logistical and administrative burdens that you talked about in order to move outside the technical skills, did you get none of that education during your training?
It does occur, I believe, but there's such a fire hydrant effect
Yeah.
of residency and fellowship. I will even say that, I trained at a really strong residency program at the University of Missouri, Kansas City, a 5-year general surgery program that is based in the Midwest. So you get a lot of autonomy as you go through. You really develop excellent skills, open, laparoscopic, robotic, trauma, ICU, all kinds of things, and lots of specialty. But when I went to fellowship, it was again as if I had, had to break down to the very
Yeah.
beginning and kind of start over in many ways, because you learn at such a granular detail how to be an excellent technician, how to be a good decision maker. I will say that while those skills do translate to what you do administratively and managerially in your attending role, they are quite different. And I will say that until you do it yourself, it's
Mm.
nearly impossible to try to learn it secondhand.
So what kind of setting do you practice in now? Is it a private practice setting? Is it a medical academic center setting?
Yeah, it's a small community hospital. We are down the street from a really big academic center that has served as a really excellent base for collaboration and working together on patients and having a good community of people to work with. But I am at a small community hospital, which presents its own fairly unique set of challenges coming from a fairly academic background.
All right. So let's talk more about your passion for surgery in your Kevin MD article is titled The Joy of Surgery, How One Doctor Discovered Her Passion. How did your article come together?
There's been a lot of talk of burnout overall,
Mm.
I think, in the practice of medicine, and especially with the COVID pandemic and sort of the fallout from that, where I think people felt like they were doing things maybe just because they were told to do things or doing things just to sort of get through and get by.
Mhm.
And I will say that I fell into that somewhat too. Residency can be very long hours, can be very daunting challenges where you're trying to multitask all the time, trying to make everyone happy, making absolutely nobody happy. And it's a very difficult time. And then on top of that, you do still have all of your regular social family, obligations that sometimes we treat as extracurricular rather than just as important as what we do clinically. So it really took me having a little bit of time and having a little bit of more say in the decision making process to actually reconnect with why I was doing what I was
Yeah.
doing and why I wanted to be there in the first place. Because I do think if you don't have that, if you allow the burnout to take hold, if you allow yourself to sort of disconnect from the practice of what you're doing, it will also affect how well your patients do too. And it will also eventually kind of affect everything you do.
So Obviously, surgery, very demanding, residency and bariatric fellowship, of course, very demanding as well. And you throw in the pandemic on top of all that during training. Now, tell me, like, some of the darker days. You said that there are some days that you sometimes were questioning what you had to do. So, what about it made you question? What were you feeling?
You're asking me, which is very kind and I'm very lucky to be asked. I do think a lot of people, probably thousands to tens of thousands of people, have stories very similar to mine. I remember going into when the pandemic first started, I was actually at the VA hospital in Kansas City. And it was almost on a daily basis that we were changing protocol, even for entering the building. So it became almost like you're entering a gated community every day and trying to figure out what's going on. And then I switched to a private hospital in Kansas City called St. Luke's at that time. And I remember I was on the transplant service at the time, and you're walking through the hospital almost like it's a deserted ghost town, like it's a haunted house almost sometimes, because there's so few people there. Certainly no families, no other people who you don't really understand how instrumental that kind of support is for taking care of your patients and figuring out what to do with patients and getting support until it's gone. And it really felt like I was walking through a warehouse sometimes when I was in the hospital. It was also very daunting to do trauma at that time, because at that point we didn't really even know how COVID was transmitted, for instance. So we were wearing, N95s and peppers and having all kinds of protocols for what we were wearing. And I remember, flying into a trauma room for a second, forgetting that, we were in the midst of a pandemic and not putting on my gown and things like that. And an attending literally like smashing the PPI into my chest, basically like, get yourself covered, take care of yourself, protect yourself. What are you doing? And so it was a time of a lot of, I think, coming to terms with things, coming to terms with the fact that you did have a lot of support. You did have a lot of people there together with you, that we were all in the same boat while we were taking care of people who were sometimes, dying right in front of us, and we couldn't do anything about it other than support them as best we could. So it was a really rough time in a lot of ways. I'm really glad we're not there anymore.
Yeah. How did you find the strength to go through that? Or what made you see that, hey, you had other people around you that was going through the same thing?
Yeah, well, luckily, I mean, I was part of a residency program where we had 5 residents a year, so pretty medium-sized program, really incredible faculty and staff around us. I will also say that it was a time that I saw a lot of silos breaking down. We sometimes mention that medicine is kind of separate. It's surgery versus medicine versus GI versus the
Yeah.
ED or something like that. But in this circumstance, at least for the first year or so, it really felt like a lot of those barriers broke down, and everyone was kind of laughing together or crying together or trying to figure out how to make each other's lives just a little bit easier. And I think that actually that mentality has stayed. I think it's a lot less separated than it used to be, at least in my perception of it. We all kind of understand that it's not us versus them, it's us and them for the same goal. So that really helped. I will say there was also a huge outpouring from the community, certainly in Kansas City where I lived. The mayor was on top of things really fast. Family and friends were on top of things really fast. And even if people didn't agree politically, once that became an issue, there was no question that people supported their, healthcare workers and hospitals and things like that. So while a very, very dark time, it did seem like people really were capable of supporting each other and did that really well.
One of the things that earlier was that it does take a village in order to sometimes come out of burnout and kind of reconnect with their passion of medicine. There are a lot of physicians, like you said, are still siloed, and it's very difficult to find that community. So how does one go about doing that?
Yeah. So, some ways that have really worked for me, when I came to a small community hospital here in Iowa City, I actually didn't know a single person here. So I was recruited to sort of build a program, start a robotic program, and really thought that would be a great opportunity. And it has been, but I didn't really consider what it would be like to be somewhere where I didn't know anyone medically or socially. So it took a minute, and, I kind of popped up in people's offices. I went out and shook a lot of hands and talked a lot with people in our medical community. Luckily landed in a really great neighborhood where I got to know my neighbors pretty easily and things like that. I also ended up being pretty involved in our professional organizations. As a bariatric surgeon, we have several like ASMBS and SAGES and things like that are national organizations that have served also as a form of community for me as well. So those are definitely things that I would recommend to other physicians. I think we underestimate the value of things like the AMA and other professional organizations even in creating both local and broader communities for ourselves. I will say that, as doctors and surgeons and things, we really like talking about what we do,
Yeah, yeah.
even if it's to complain or to vent or something like that. So, really having people that do what you do that you can talk with openly about what you're dealing with and about struggles and about realities of practice, to me at least, has been a really critical aspect of coming out of some of that burnout and figuring out how much I actually like doing this.
One of the parts in your article was how much you loved operating and your passion for surgery really shone through. So I was wondering if you could share with our audience here what's it like for you in the operating room?
Yeah, so it's almost like when you're in an operating room, you're with a lot of other people in your mind, at least. When we train through surgery and residency and fellowship, you kind of pick up this advice and the ways that other people do things, and they become in a almost like a quilt of what you are ultimately, or a mesh of what you are. So I constantly have people's thoughts and
Hmm.
sayings and things like that running through my mind that probably resonates with a lot of people who have gone through training. And to me, honestly, I know this sounds a little bit crazy, but it's the calmest part of my life.
Oh,
It
yeah.
is the part in which I, as an individual, can have the most immediate impact on someone. It's also the one in which I feel like there is the most control of an environment as much as possible. And it also is the point at which I feel the closest to the patient. And I know that seems funny because I actually am primarily a robotic surgeon. So physically, I'm about, 10, 20 feet away from my patient physically throughout most of the case. But the connection is so focused and such a one-on-one interaction with what is going on with that person in their body, with you in your mind and your hands. I mean, I'll hate to say like the word, it's almost a magical connection, but that is kind of what it feels like when things are going well, which usually is the case. I will say it can also quickly turn into a pretty chaotic and difficult situation when things are not going well. But I will say, even in the situations where there is difficulty or something unexpected happens, I remember one of my attendings in residency, who's a trauma and critical care surgeon. He, no matter what the situation, patient could be coding, we could be doing a thoracotomy, we could be, there could be 20 people in the room, but he was always the calmest, the most collected, cool as a cucumber kind of person. And though I'm not always that way, that's kind of what I strive to be, because no matter what, people understood this is the person who's in control of the situation, going to help out, going to be present, going to be solely focused on what's happening and not letting anything get to them. And that's your role as a surgeon in the OR, is to be that person no matter the situation.
So you mentioned that you do a lot of robotics, and as a bariatric surgeon, tell us a little bit about that intersection. What's the current state of the art when it comes to that?
Yeah, super interesting question, actually, because there's a lot of movement right now in robotics. The dominant player on the market is called Intuitive Surgical Systems. They make the Da Vinci robot and have about 80% of the market. But there are many others that are coming out with robots, and there are some other robots already on the market. So Medtronic has one that's being used globally and isn't quite yet FDA approved, but getting there. Same thing with Johnson and Johnson and some others as well. And then there are other robots like orthopedic striker robots and Senhance and others. Bariatrics is actually a hugely growing field, excuse the pun, but in many ways, including robotics. And the robotic platforms themselves do offer some benefits when it comes to this patient population. We're working with abdominal walls of people who have BMIs typically over 40, typically with many comorbidities. So anything that you can do to make the perioperative planning in the OR safer for that patient ultimately can impact outcomes pretty drastically. That's nothing to say also about the fact that you can actually standardize your procedures a little bit easier. As a surgeon, you can have control of your camera and instruments in a different way than you can laparoscopic or open. And ultimately, I will say that when you're doing something like, between 5 and 10 cases a day, ergonomics matters too. So everything about the procedure really is impacted and ultimately has a pretty big impact on how patients recover from surgery too.
So, in the primary care setting, I do internal medicine primary care, and I'm seeing a patient who may be a candidate for bariatric surgery. What kind of questions should I be asking them, or what kind of questions should they be asking me if they're considering whether robotic bariatric surgery or bariatric surgery in general is right for them?
Yeah, that's also a really interesting question because we have a lot of those questions ourselves in the office and in our professional societies and kind of globally. So bariatric surgery is something that historically I think has been seen as pretty extreme or sort of the last resort for people who have excess weight and want to manage their weight. But there's a lot of good data that's coming out now that maybe we should be considering it a lot earlier and for a lot more patients. In fact, fewer than 1% of eligible patients ever actually see a bariatric professional, whether that's a surgeon or a bariatrician. So that's, I think, a pretty stunning number. Even in running the numbers in our own hospital, we have thousands of patients that would qualify for evaluations. And certainly we're not seeing thousands of patients in our clinic. So there is a mismatch there. Really, anybody who's interested in weight management, who has a BMI over 30 especially, would be a candidate for a discussion of bariatric surgery or other interventions to help, such as medical management with medication, certainly physical activity, exercise, mental health, and anyone who has comorbidities that are related to obesity as well. Those things include things like high blood pressure, diabetes, but even things that we may not necessarily think of, like NASH and PCOS, are related to, even osteoarthritis. So we have a partnership with our orthopedic surgeons in town, and that's been, I think, very beneficial for patients with joint problems as well, in either getting to surgery or in some cases not even needing their joint surgeries when they go through the process with us.
We're talking to Maria Iliakova. She's a bariatric and general surgeon. Her Kevin MD article is titled The Joy of Surgery, How One Doctor Discovered Her Passion. Maria, tell us why you love what you're doing, and maybe you can end off with some take-home messages to the Kevin MD audience.
Yeah, so I love that. I came into medicine not necessarily knowing what I was going to do. In fact, thought maybe I would do internal medicine and do infectious diseases or neurology or something like that, maybe more of a research focus, and kind of fell into surgery after a transplant rotation that I did. And I am so lucky that I got to find something that ultimately I couldn't love more, I couldn't enjoy more. And that's surgery, but specifically working in bariatric surgery with patients who have weight management and lots of other comorbidities and everything else. I'll tell you, our coordinator for our program just put up a board in our office that asks people their non-weight victories, their non-scale victories, basically. And we had a patient who put on there, I'm able to be off of my insulin, off of my diabetic medications. And the last line there was, I get a second chance of life. That's why we do this. That's the best compliment a patient could ever possibly give you, is that you've given them a second chance and you've given them a life, right? So everything that we do is ultimately for the benefit of giving people better quality of life, better opportunities, and it's extremely rewarding.
Maria, thank you so much for sharing your story, time, and insight, and thanks again for being on the show.
Thank you so much, Kevin. It's really great to be with you.